Is your medication making you heat sensitive? Warning signs to watch for. Are you feeling unusually sensitive to heat lately? You might be surprised to learn that the medications you are currently taking could be the culprit. With the summer heat intensifying and heat warnings becoming more frequent, many individuals may not realize that their prescriptions could be exacerbating their discomfort during these warmer months. It's a tough reality to face. Certain medications can significantly heighten the discomfort of heat for those who rely on them. According to Sarah Dawson, a clinical pharmacy specialist at Centara Health, millions of Americans are prescribed these medications, and many may be taking more than one, which can increase the risk of heat-related issues. The list of medications that can contribute to heat sensitivity is quite extensive. It includes common antidepressants like Prozac, topical acne treatments such as benzoyl peroxide, blood pressure medications, antihistamines, antibiotics, and even over-the-counter pain relievers like ibuprofen. You might notice that some medication labels advise you to avoid heat, while others caution against sun exposure. But what's the distinction? Dawson explains, when it comes to medications and heat, they can make you more susceptible to heat-related illnesses, including heat stroke, heat rash, fainting, and dehydration. On the other hand, if a medication warns you to stay out of the sun, it's because it can make your skin overly sensitive to sunlight and UV rays, which can lead to painful sunburns. To combat these risks, doctors recommend staying hydrated, keeping cool, and protecting your skin with clothing or sunscreen that has an SPF of 30 or higher. It's also important to remember that medications themselves can be adversely affected by heat. Patients should be particularly cautious with mail-order medications, whether they are injectables or tablets. These should ideally be stored at room temperature, Dawson advises. If your delivery is left sitting outside, it's wise to have a neighbor pick it up or arrange for it to be sent to your workplace. For those who carry medications like insulin, inhalers, or EpiPens, it's crucial not to leave them in a hot car or exposed to direct sunlight for extended periods, as this can degrade their effectiveness. Dawson notes, if you're planning a day at the beach or an amusement park and need to take your medication with you, it's best to keep it cool. A cooler with ice can help ensure that your medication doesn't overheat. If you have any uncertainties regarding your prescriptions or any medications you are taking, don't hesitate to consult your pharmacist or review the accompanying instructions and literature. But here's where it gets controversial. Are we fully aware of the implications of our medications on our health during extreme weather? What do you think? Have you experienced any unexpected side effects from your medications in the heat? Share your thoughts in the comments. Medications and heat. How common drugs raise your risk of heat-related illnesses? Sun-with-face pill. As the sweltering summer months roll in, bringing with them soaring temperatures that often exceed 90 degrees, ensuring our safety in the heat becomes a paramount concern. However, there's an important aspect that many people overlook. Certain medications can significantly heighten the risk of experiencing heat-related illnesses. In a recent segment of Monday Morning House Call, Dr. Jenora Parker, who oversees specialty and outpatient pharmacy services at GBMC, sheds light on this critical issue. She discusses specific medications that individuals should be cautious about and outlines the warning signs of heat-related illnesses that everyone should be aware of. This is particularly relevant as we enjoy outdoor activities during the summer, but it's essential to recognize that some common prescriptions and over-the-counter drugs can interfere with our body's ability to regulate temperature. For instance, diuretics, which are often prescribed for high blood pressure, can lead to dehydration, making it harder for the body to cool itself. Similarly, certain antidepressants and antihistamines can impair sweating, a natural mechanism our bodies use to maintain a safe temperature. But here's where it gets controversial. While many people take these medications without a second thought, they may not realize the potential dangers they pose in extreme heat. Are we doing enough to educate patients about these risks? As we dive deeper into this topic, it's crucial to stay informed and proactive. Dr. Parker emphasizes the importance of recognizing symptoms such as dizziness, excessive sweating, or confusion, which can indicate that someone is suffering from a heat-related illness. So, as you enjoy the summer sun, take a moment to consider the medications you or your loved ones are taking. Are they putting you at risk? We invite you to share your thoughts and experiences in the comments below. Do you agree with Dr. Parker's insights, or do you think more should be done to address this issue? Let's discuss. Heat wave alert: how psychiatric medications increase risk of heat-related illnesses. The upcoming scorching temperatures could pose a significantly heightened danger for those using psychiatric medications, and it's a topic that certainly invites further conversation. The Citizens Commission on Human Rights, CCHR, has issued a warning about how many psychiatric drugs can disrupt the body's natural ability to manage heat, potentially leading to serious health complications. As the sweltering heat is predicted to extend for weeks across vast portions of the U.S., it's essential to understand the implications of these medications. Many psychotropic drugs can interfere with the body's cooling processes, either by raising body temperature or diminishing awareness of overheating signs. If individuals fail to take appropriate measures to cool down, the consequences can range from mild heat cramps to more severe complications like heat exhaustion and the potentially fatal heat stroke. The risks tied to these medications are clearly documented. Specifically, antipsychotic medications carry a notably high risk of heat-related issues because they can reduce the normal sweating response, the body's primary cooling mechanism. This alteration not only inhibits the natural urge to drink fluids or remove excess clothing, but also makes users less aware of rising body temperatures. Even brief exposure to high temperatures can swiftly elevate body temperature for someone taking antipsychotics. Attention should also be given to stimulant medications prescribed for attention deficit hyperactivity disorder, ADHD. These can raise body temperature and hamper the body's cooling ability, creating heightened risks particularly for energetic children during extreme heat events. Among antidepressants, newer options like selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, have been shown to cause dehydration, which, compounded by sweating in high heat, increases the risk of heat-related illnesses. Older tricyclic antidepressants can similarly hinder sweating and body temperature regulation, again raising the risk during very hot summer days. And Godick, the president of the CCHR National Affairs Office, highlights the urgency of this issue. Patients should recognize that engaging with these psychiatric medications during high heat conditions can lead to serious, even lethal health emergencies. When body temperature climbs to hazardous levels, prompt action is necessary to avoid severe bodily harm, which can sometimes be fatal. Research indicates that psychiatric medication use can nearly double the risk of death during heat waves. In light of the oppressive summer heat, medical professionals advise staying hydrated, avoiding strenuous activities, and donning light, loose-fitting clothing to mitigate heat-related risks. Guidelines that take on extra significance for those on psychiatric medications. About the organization, established in 1969 by individuals associated with the Church of Scientology and the renowned psychiatrist Thomas Szasz, the Citizens Commission on Human Rights aims to expose abuses within mental health systems and promote dignity and human rights within the field. What are your thoughts on the dangers posed by psychiatric drugs in extreme heat? Do you find that this issue is gaining adequate attention? Share your opinions and experiences in the comments. Dialogue around such critical health concerns is vital.